This so-called pharmacare legislation will not bring universal prescription drug coverage to Canadians. Section 8.2 of the legislation under the heading Discussions says the following. The Minister must initiate discussions with the aim of continuing to work toward the implementation of national universal pharmacare. So let's break that down. What does the legislation require the Minister to do? He must initiate discussions. Okay, fair enough. What do those discussions do? Well, they have the aim of continuing to work towards a goal. So what? That's it? That's the big reveal? The Minister is required to talk to some people to work towards an ideal. That sounds like every scam artist running a Ponzi scheme. Schmooze as many people as you can, sell them on an idea that is nothing more than smoke and mirrors. And this legislation is literally that, smoke and mirrors, conning Canadians into thinking that there is a pot of prescription drug gold at the end of the rainbow. It's not prescription drug gold at the end of this legislation. In fact, every single Canadian will be just that much poorer if and when this gets implemented. Why? Because it's a direct attack on Canadians' private health insurance and drug coverage. Did you know that according to the Globe and Mail, there are 102 government drug programs operating today, along with 113,000 private insurance programs? Stats Canada reports that 79% of Canadians currently have health insurance which includes drug coverage. The completely independent Parliamentary Budget Officer analyzed how much it would cost Canadian taxpayers if universal pharmacare was implemented. Their analysis is that pharmacare would cost about $40 billion every year. And more importantly, that would be about $13 billion more than is being spent today. And keep in mind that pharmacare would replace existing public and private health drug plans. Generally, private health care plans have better coverage than public ones. That would leave most people worse off. So overnight, 4 out of 5 Canadians will lose the prescription drug coverage they have through their employer, union, school, spouse, parent, or provincial government plan. But who's paying for this? Well, the federal government, which means you and I, through increased taxes. Either way you look at this, this will result in a multi-billion-dollar spending increase paid for by you and I. You know who will really benefit from this? Private companies who provide insurance to their employees. Why? Because today they're paying for private drug insurance. Once this program kicks in, they can now cancel those programs because the government is paying for this now. That will save those companies significant dollars. Essentially a transfer of dollars from the federal government directly to those companies, paid for by you and I.